benign prostatic hyperplasia, BPH, and prostate cancer are common conditions that impact the prostate, a gland vital in the male reproductive system. Nestled just below the bladder, the prostate plays a key role in semen production. In youth, it's usually the size of a walnut, but with age, it tends to grow larger. As you age, the chances of encountering prostate issues rise. Though these two conditions affect the same gland, it's crucial to clarify that BPH does not lead to prostate cancer. They can coexist, but one does not cause the other. Despite this, there are some same symptoms and risk factors. Imagine your prostate as a helpful organ tucked beneath the bladder, assisting in the creation of semen. It starts small like a walnut when you're young, but as the years pass, it may grow larger. And as time marches on, the likelihood of prostate-related problems increases. Even though these conditions affect the same gland, it's important to emphasize that BPH does not pave the way to prostate cancer. These issues can exist together, but one doesn't trigger the other. Nevertheless, they do share some common symptoms and risk factors. Now, let's compare the risk factors for BPH versus prostate cancer. The term benign in benign prostatic hyperplasia signifies that it's not a cancerous condition. Hyperplasia indicates an increase in the number of non-cancerous cells. BPH is also commonly referred to as an enlarged prostate. Why some men have enlarged prostate glands and why some get prostate cancer. You see, when men get older, their bodies change. One thing that happens is that a certain hormone called testosterone goes down. Alongside this, there are two other hormones, DHT and estrogen. That might start to increase a bit. Researchers suggested that these changes in hormones might make the prostate, which is a part inside a man's body, grow way larger than its original sizes. Now, having a big prostate isn't a big problem by itself, but it can make it harder to pee sometimes. Most guys don't have to worry about this until they're older. It's quite rare for younger men to have this issue, though. There are some things that can make it more likely for a man to have a big prostate. One of those things is if someone in your family had it too. It can also happen if you're not very healthy or your lifestyle is on the loose side. So take care of your health. Remember, always choose the right way to eating, because let's face it, you cannot make any wealth if you have no good health. Now, let's talk about the scarier prostate cancer. This is when cancer cells in the prostate start growing undetected for a long time in most cases. Men who are 50 or older are the ones who need to be careful about it. About 13 out of every 100 men might have this happen to them in their lifetime. But the saddest part is they may never. What are the other risk factors for prostate cancer include? It could be race. African American individuals face the highest risk, followed by white, Hispanic, and Native American individuals. Family history can also be the reason. Having a father or brother who has had prostate cancer puts you at an elevated risk. Is obvious. Diet. A diet high in fat can increase your odds of developing prostate cancer. Now to the part where most get it wrong, or at least confused. What are the symptoms of BPH and prostate cancer? This could be tricky, so pay attention and don't skip a word. Frequent or urgent urination. People with BPH often feel like they have to go to the bathroom, more often than usual, especially at night. This happens because the enlarged prostate can squeeze the tube that carries urine. Difficulty starting urination. Sometimes it can be hard to start peeing when you want to. It's like a slow faucet that takes a while to begin flowing. Weak or slow urine stream. The stream of pee might be weak or not as strong as it used to be. This is because the prostate is blocking the way. Discomfort while peeing or ejaculating. Some men may feel pain or discomfort when they pee or ejaculate. Dribbling after urination. After finishing, some urine might still come out, which can be annoying. Usual urine color, or sometimes the urine might look or smell different than usual. Feeling like the bladder isn't empty. You might still feel like you have to pee even after you've just gone. Straining to urinate. This means you have to pumo and push hard to get the urine out. Now let's look at the symptoms of prostate cancer. Burning sensation while urinating. Some men with prostate cancer might feel a burning sensation when they pee, like it hurts to pee. Blood in urine or semen. If you see blood in your pee or semen, that can be a sign of prostate cancer. Persistent pelvic, hip, back, or bone discomfort. Unlike BPH, prostate cancer can cause ongoing pain in your lower body or bones. This pain doesn't go away and might get worse over time. Now let's compare the two. Both BPH and prostate cancer can cause frequent or urgent urination, making you go to the bathroom more often. They can also both lead to difficulty starting urination and a weak urine stream. Discomfort during urination or ejaculation can be a symptom of both conditions. However, if you experience dribbling after urination, unusual urine color or odor, and a sensation of an incomplete bladder emptying, it's more likely due to BPH. On the other hand, a burning sensation during urination, blood in urine or semen, and persistent discomfort in your pelvis, hips, back, or bones are more specific to prostate cancer. Remember, if you ever have these symptoms, it's essential to talk to a doctor. They can help figure out what's going on and provide the right treatment. Treatment for BPH. When your prostate is slightly enlarged and it's not causing you big problems, you might not need immediate treatment for BPH. Unless your symptoms bother you or your doctor finds issues during your checkup, you can often wait. If you do have symptoms, there are things you can try on your own to feel better. Drink less before bed. Try not to drink too much liquid, especially before you go to sleep. Cut down on alcohol and coffee. Drinking less alcohol and coffee might help. Avoid diuretics. These are medicines that make you pee more. Avoid taking them, especially at night. Exercise your pelvic muscles. Doing special exercises can make your bladder stronger. If these don't work, your doctor might give you medicine. There are a few types. Alpha blockers. These help your muscles relax, making it easier to pee. Phosphodiesterase 5 inhibitors. These aren't just for erectile problems. They can also help relax your urinary muscles. 5-alpha reductase inhibitors. These stop a hormone that makes your prostate get bigger. In some cases, if medicine doesn't help, your doctor might suggest some simple procedures to treat your enlarged prostate. These include things like using radio waves or ultrasound to get rid of the extra tissue. In more serious cases, they might do surgery to take out the part of your prostate that's causing problems. This can be done in a few ways, including through your penis or with tiny cuts. Treatment for prostate cancer. Treatment for prostate cancer depends on your situation and how healthy you are. Sometimes, if the cancer is small, slow-growing, and not causing any issues, your doctor might recommend watching it closely. This means they won't treat it right away, but they'll check it often to make sure it's not getting worse. If you need treatment, there are a few options. Radiation therapy. This is when high-energy rays are used to kill the cancer cells. It can be done from the outside like a big X-ray or by putting tiny radioactive seeds inside your prostate. Prostate surgery. If the cancer is contained in your prostate, your doctor might recommend removing it. They can do this through a big cut in your belly or with small cuts using a camera. Focal therapies. These are newer treatments that target just the cancer and not the whole prostate. They include things like using high-energy sound waves, like for BPH, freezing the cancer cells using lasers or using light to kill the cancer. Systemic therapies. If the cancer has spread, your doctor might suggest treatments that work throughout your body. This can include chemotherapy, strong medicines to kill the cancer cells, hormones to slow the cancer down, or medicines to help your immune system fight the cancer. Remember, the treatment for prostate issues depends on the specifics of your situation, so always talk to your doctor to figure out what's best for you.